Track 8, Chapter 3, PIP, What do we provide support for? This track is approximately 14 minutes long. Chapter 3, PIP, What do we provide support for? Chapter Summary 74. In this chapter we are going to consider how the extra costs of disabilities or health conditions are defined, whether DWP should improve the support we offer by finding alternative ways to contribute to the extra costs and needs of disabled people and people with health conditions. What kinds of support beyond help with extra costs disabled people and people with health conditions need to fulfill their potential and live independently. Case for Change 75. PIP was designed to help disabled people and people with long-term health conditions by making a cash contribution towards their extra costs. It does not require any calculation of these costs, nor does it require recipients to spend their award in a particular way. Some people on PIP may have relatively small one-off or ongoing additional costs related to their disability or health condition that are fully covered by their award, while others may find the current system does not provide enough support to meet their needs. 76. We want to consider whether supporting people through direct regular cash payments is still the best approach, or whether other approaches would better target our resources, delivering the right support to the people who need it most. We want to know whether there are potentially groups of people who might need more than the current system provides and what kinds of support they need. 77. Different models are used in other countries. For instance, in New Zealand, people submit supporting medical evidence verifying their health condition and also provide estimates of their additional costs, e.g. £50 per month for physiotherapy, which are then approved for an ongoing award. In Denmark, awards for extra costs are determined on a case-by-case basis and issued by local government. Note 9. Further information on international systems can be found in Annex B. 78. In the United Kingdom, we have had a predominantly cash transfer system for extra costs since the introduction of attendance allowance and mobility allowance in the 1970s. Given there are other models of support used internationally and the changes in disability benefit caseloads over time, we think it is right to ask about other models of support and the impact of these approaches, including stopping regular cash payments if they were to be adopted here. Types of extra costs. 79. Broadly, there are three different types of costs faced by disabled people and people with health conditions. Tangible costs that arise as a result of a person's disability, which could include aids, appliances or care services that only a disabled person would require. For example, medication, mobility vehicles, walking aids, wheelchairs, help at home from a paid carer, or supported living services. Some aids are one-off costs, while other costs are ongoing. Some items or services may be provided by the NHS or through social care. Costs for non-specialised goods that are increased because of a person's disability or health condition. This might include needing to heat their home to a higher temperature due to immobility or breathing difficulties, or increased energy costs due to specialist equipment required at home to support a person's disability or health condition, such as a ventilator. It could also include increased travel costs due to reliance on taxis, and extra costs for clothing and bedding due to incontinence or wear and tear from greater use. Less tangible costs, such as needing to spend more to access the same goods and services. This might include people paying higher premiums on insurance products, or they may pay higher housing costs because their needs limit the choice available. 80. In the current PIP system, claimants choose which costs are the greatest priority to them and spend their award money accordingly. We know from research that people often use their PIP payments on core household expenditure, such as utility and housing costs. Note 10. Uses of health and disability benefits, gov.uk. https:// www.gov.uk/publications/uses-of-health-and-disability-benefits. We also know that some disabled people view their PIP award as compensation for being disabled, rather than as an award for extra costs. Note 11. DLA-reform-consultation.pdf publishing.service.gov.uk assets.publishing.service.gov.uk/assets.media/5A7ABB8640F 0B66A2FC026AA/DLA-reform-consultation.pdf. 81. For some people, various extra costs are already met through other provision, and, therefore, financial support may be duplicated. For instance, people receiving the daily living component of PIP and who require aids such as walking sticks may have them supplied by the NHS. Any new scheme would need to work alongside existing provision to ensure the best use of resources. 82. PIP is intended to provide a contribution to a person's extra costs, not necessarily to cover them fully. Equally, alternatives to a cash transfer system like those listed below may not be able to address all of the additional costs and needs related to a person's health condition or disability, particularly any costs that are less tangible. Therefore, it is important for us to understand views on possible alternative models and which specific sorts of costs should be prioritised. Alternatives to a cash transfer system. 83. If DWP were to consider other ways of supporting people with disabilities and long-term health conditions apart from providing regular cash payments, it could continue to contribute to people's extra costs through alternative models which could include catalogue/shop scheme. In this kind of scheme, there would be an approved list from which disabled people could choose items at reduced or no cost. This would likely work better for equipment and aids rather than for services. Voucher scheme. In this kind of scheme, disabled people would receive vouchers to contribute towards specific costs. It would work for both equipment/aids and for services. A receipt-based system. This would involve claimants buying aids, appliances or services themselves and then providing proof of their purchase to claim back a contribution towards the cost. This could work in a similar way to Access to Work, which provides grants for equipment, adaptations and other costs to help disabled people to start and stay in work. One-off grants. These could contribute towards specific significant costs such as home adaptations or expensive equipment. It could involve a person supplying medical evidence of their condition to demonstrate the need for equipment or adaptations. 84. While these alternative models help people with the extra costs of their disability or health condition, other forms of support including healthcare, social services, care provision and respite are also important to help people to realise their full potential and live independently. We would like to understand whether some people receiving PIP who have lower or no extra costs may have better outcomes from improved access to treatment and support than from a cash payment. 85. We would also like to know whether there are specific groups of people who have a need of a greater level of support than they currently receive, and whether this support should be financial or take a different form, such as improved access to healthcare, such as mental health provision or physiotherapy, or enhanced local authority support, such as care packages, respite or home adaptations. We will further explore ways of improving people's access to services in Chapter 4. Passporting. 86. PIP passports claimants to a wide range of benefits and services offered by DWP, other government departments, and more widely by other organisations and schemes, such as the Motability Scheme. 87. In Transforming Support, the Health and Disability White Paper published in March 2023, we set out our plans to remove the Work Capability Assessment, WCA, and introduce a new PIP passporting model, where anyone in receipt of PIP and the UC standard allowance would receive a new UC health element. 88. PIP is also used in the current system to determine whether a person's carer is entitled to carer's allowance. We recognise the important role that unpaid carers play in supporting disabled people and people with health conditions. 89. If PIP was replaced by an alternative model, we would need to consider the implications for how we determine eligibility to those linked benefits and services. We would like your views on how this should work. Chapter 3. Consultation Questions. Question 18. PIP provides a contribution towards extra costs. Which extra costs incurred by disabled people are the most important for a new scheme to address? Please rank the following options in your order of importance. Equipment and aids, medication and medical products, personal assistance, costs arising from hired physical and/or emotional support within and outside the home, e.g., help with household tasks or assistance with transportation. Health and personal care, including physical therapies, talking therapies, massages, etc. Also includes greater spending on personal hygiene or appearance. Extra transport costs, from reliance on taxis or accessible taxis, hospital parking fees, vehicle adaptations, etc. Additional energy and utility costs arising from disability or health condition, including digital access. Additional food costs arising from disability or health condition. Additional spending on clothing, footwear and bedding items arising from disability or health condition. Higher costs of insurance. Additional housing costs arising from disability or health condition, including home adaptation costs. Question 19. In relation to question 18, please explain your answer below and tell us about any other important kinds of costs not listed above. Question 20. What are the benefits and disadvantages of moving to a new system for PIP claimants? A catalogue/shop scheme. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 21. What are the benefits and disadvantages of moving to a new system for PIP claimants? A voucher scheme. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 22. What are the benefits and disadvantages of moving to a new system for PIP claimants? A receipt-based system. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 23. What are the benefits and disadvantages of moving to a new system for PIP claimants? One-off grants. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 24. If PIP could no longer be used to determine eligibility to passport to other benefits and services, what alternative ways could service providers use to determine disability status? Question 25. If PIP could no longer be used as the eligibility criteria to additional financial support in universal credit, what alternative ways of determining eligibility should we use? Question 26. Are there specific groups of people whose needs are not being met by the current PIP provision and have a need for a greater level of support? What form should this support take? E.g., help with specific extra costs, access to improved healthcare such as mental health provision, or enhanced local authority support such as care packages and respite. Question 27. Instead of cash payment, are there some people who would benefit more from improved access to support or treatment? For example, respite care, mental health provision, or physiotherapy. This concludes track 8.